care world. Today we will learn about a very important topic, the continence care. Let's start.
Hello and a very warm welcome. If you're a care worker or a care support worker, then you are in exactly the right place. Today, we're going to be talking about continence care. It's such a fundamental part of providing compassionate, dignified support, and it truly makes a world of difference in people's lives.
In our time together, we're going to break down the essentials of continence support. We'll look at what it is, the huge impact it has on a person's life, and of course, the practical, hands-on skills you need. The goal here is simple: to make sure you feel confident in providing excellent, person-centered care. Okay, let's get started.
All right, so first things first. Before we can do anything else, we really need to build a solid foundation. So what do we actually mean when we talk about continence? Getting the basics right is always the best place to start.
At its heart, continence is simply the body's ability to control when and where we go to the toilet. Now, it might sound pretty straightforward, but it's actually an incredibly complex process. It needs our muscles, our nerves, and our brain to all be working together in perfect sync. So if you think of continence as being in control, then incontinence is the opposite of that. It's the involuntary, the unintentional loss of urine or stool. It's a really simple way to think about it, but it's an absolutely crucial distinction. It's also so important to remember that incontinence is a very common condition. It's nothing at all to be ashamed of. You know, incontinence isn't a one-size-fits-all thing. It can show up in different ways. For example, you might see stress incontinence, which is when a little bit of urine leaks out during a cough or a laugh. Then there's urge incontinence, that sudden, overwhelming need to get to the toilet right now. Overflow is when the bladder doesn't quite empty all the way. And then there's functional incontinence, which is when a person can't get to the toilet because of a physical or even a cognitive barrier, like struggling with buttons, or maybe not recognizing what the toilet is for. So let's have a quick look at the plumbing, so to speak. The kidneys are busy making urine, which then gets stored in the bladder. When it's time to go, it passes out through the urethra. For all of this to work smoothly, the muscles have to coordinate just right, holding on tight when needed and then relaxing at the proper time. Any little disruption in this system can cause problems.
So what kind of things can cause these disruptions? Well, the list is pretty long. It could be simple age-related changes in the body, a urinary tract infection, or even something like constipation, which puts extra pressure on the bladder. Sometimes mobility issues just make it hard to get to the loo in time. Conditions like dementia can affect a person's ability to even recognize that they need to go. And sometimes it can be a side effect of medication. As you can see, it's rarely just one single thing. It's often a really complex puzzle.
Okay, so now that we have a handle on the what, let's talk about the why. Why is the care you provide so incredibly important? Well, it has a massive impact on a person's quality of life in ways you can see and in ways you can't.
I want you to just think about this for a second. When continence care isn't what it should be, the fallout can be really severe. It can affect a person physically, emotionally, and socially. This is why getting it right isn't just another task to tick off a list. It's absolutely fundamental to a person's well-being. When we look at the physical side of things, the risks are really, really serious. Being in contact with moisture for too long can lead to very painful skin breakdown and infections. It dramatically increases the risk of developing pressure ulcers. It can also cause recurring, distressing UTIs. And sometimes, to try and avoid accidents, a person might start drinking less, which can then lead to dehydration. And that just opens up a whole new can of worms. And that's just the physical side. The psychological impact? Well, it can be just devastating. It can lead to a huge loss of dignity and self-esteem. People can feel embarrassed, so they might start to pull away from friends or activities they used to love. This can easily spiral into anxiety, depression, and this awful feeling of losing their independence. Your respectful, skilled, and gentle support is the key to preventing all of this. And that right there is our goal. You see, effective and compassionate continence care isn't just about managing a physical symptom. It's about stopping these awful consequences from ever happening. It's about actively promoting a person's comfort, their health, and their overall quality of life. Which, brings us perfectly to our next topic. At the heart of all truly excellent care is the individual. So let's focus on what a person-centered approach really looks like when it comes to continence support. Think of these 4 principles as your compass. Number 1, always treat the individual with dignity and respect. Number 2, involve them in their own care plan as much as you possibly can. Ask them what works for them. Number 3, think about their personal preferences and their daily routines. And number 4, maintain their privacy. It's so important. Close doors, pull curtains, and always be discreet. Now, it's really important to remember, as a care worker, it is not your job to diagnose anything. But your role as an observer is absolutely vital. You're the eyes and ears for the rest of the healthcare team. You need to be on the lookout for any changes, different toileting habits, any mention of pain, signs of a UTI, any redness or irritation on the skin. So the golden rule is, if you notice something, you report it. Always pass on your concerns to your line manager or the right healthcare professional.
Okay, let's get practical. Let's roll up our sleeves and look at the specific, day-to-day things you can do to support people with their continence needs.
So what does this look like in practice? Well, it might mean giving a gentle prompt or helping someone get to the toilet at regular times. It means knowing how to use aids like pads properly, making sure they fit well and are comfortable. Excellent hygiene is non-negotiable. It's key for preventing skin problems. A bit of calm reassurance can make a world of difference in reducing anxiety. And of course, checking and changing pads promptly is absolutely essential.
And speaking of aids, here are a couple of common examples. Things like urinals can be a fantastic tool for helping someone stay independent, especially if it's tricky for them to get out of a chair or bed. The secret is to use them correctly, make sure they're always within easy reach, and to give the person the privacy they need to use them with dignity.
You know, great care isn't just about managing problems as they happen. It's also about being proactive. Promoting healthy habits is just as important as reacting to an issue, and you can make a huge difference here. And this number you see here, it's a really important one. Unless a doctor has said otherwise, you should be encouraging the people you support to drink between 1.5 to 2 liters of fluid every day. Now, I know it might sound a bit backwards. Why give someone more to drink? But it actually helps to keep the bladder healthy and can reduce irritation and the risk of infection.
And of course, it's not just about what we drink. What we eat is just as crucial, especially for good bowel health. A diet that's packed with fiber from things like fruit, vegetables, and whole grains is absolutely vital for preventing constipation. And as we've already learned, constipation can make incontinence worse. So a good diet is really a cornerstone of good continence care.
All right, we're on to our final section. And it's a big one. Let's talk about the absolutely critical duties of accurate record-keeping and respectful communication. This is the part that ties all of your good work together.
I know, paperwork. But I promise you, good documentation is so much more than just ticking boxes or filling in forms. It is a vital part of providing safe, consistent, and effective care. Your notes create a clear picture that helps the entire team, doctors, nurses, other carers, to make the best possible decisions for the person you're supporting.
So what kind of things are we talking about here? What actually needs to go in the notes? Well, you need to be specific. Record fluid intake. Note down when pads are changed. Document toileting patterns. That includes both the successes and any accidents. Always check and make a note of the skin's condition. And, just like we said before, write down any changes or concerns you've spotted. And this last point is non-negotiable. While everything we've talked about is best practice, you must always follow the specific policies and procedures of your own organization. They exist for very good reason, to ensure safety, quality, and to keep everyone protected. If you're ever not sure about something, just ask your supervisor. Okay, so as we come to the end, let's just quickly recap the absolute key takeaways from all of this. First, dignity and respect are the heart of everything. Second, your role in observing, monitoring, and supporting is massive. Third, person-centered care isn't a buzzword, it's essential. And finally, clear, accurate reporting and communication are critical to keeping people safe and well. And that's it. Thank you so much for your time and for your attention today. The skills we've gone over are absolutely vital to the health, the well-being, and the dignity of the people you support. Please never underestimate the incredible difference that your thoughtful professional care makes every single day. And finally, we'd love your help. We are always looking for ways to improve our training, so if you could take just a moment to provide any feedback or comments you have, we would be incredibly grateful. Your thoughts help us make these resources even better for the future. Thank you again.